You wake up with that familiar ache in your knees, your hands, your lower back. You move slowly at first, hoping the stiffness fades, and you're not alone. After 60, joint discomfort, muscle tightness, and low-grade pain affect millions, not because of injury, but because of a quiet, invisible process, chronic inflammation. It's not just wear and tear, it's your body's immune system sending constant low-level signals, like a fire that never fully goes out, and over time, it wears down joints, irritates nerves, and drains energy. Now, most people reach for over-the-counter pain relievers, and yes, they can help, but long-term use comes with risks, stomach irritation, kidney strain, even increased fall risk. But what if there was a natural alternative, not a miracle, not a cure, but a real, research-backed option that works with your body? There is. And it's already in your kitchen. This is the story of turmeric, a spice used for thousands of years, and why modern science now recognizes it as one of the most effective natural pain relievers for seniors. Not because of tradition alone, but because of what happens inside your body when you use it the right way. Turmeric is a bright yellow root, ground into a fine powder, used for centuries in traditional medicine and cooking. But in the last 30 years, over 12,000 studies have explored its active compound, curcumin. And the findings are clear. Curcumin doesn't just mask pain, it targets the root cause, inflammation at the cellular level. It blocks a key pathway called NF-κB, a master switch that turns on inflammation genes. It reduces levels of COX-2 and LOX, the same enzymes targeted by common painkillers, and it lowers CRP, Illinois, 6, and TNF-alpha, blood markers linked to joint damage and fatigue. In fact, a 2016 randomized clinical trial found that adults over 60 with knee osteoarthritis who took 500 milligrams of curcumin daily for 12 weeks experienced a 58% reduction in pain scores, comparable to ibuprofen, but without the gastrointestinal side effects. Another study showed improved physical function and reduced stiffness, not in months, but in as little as 3 weeks. So, yes, it works. But here's what most people never learn. Most of the benefit is lost, unless you do one simple thing. And that's why so many say, I tried turmeric, it didn't work. It's not the spice that failed, it's the method. Curcumin is powerful, but it has a weakness. Your body struggles to absorb it. On its own, curcumin is rapidly broken down in the gut and liver, with less than 1% making it into your bloodstream. That means 99% of what you eat is gone before it can help. But science has found a solution, not in a lab but in your spice rack: black pepper. More specifically, a compound in black pepper called piperine. A landmark study showed that when curcumin is taken with just 5 milligrams of piperine, about 1/4 teaspoon of ground black pepper, bioavailability increases by up to 2,000%. Participants had 20 times more curcumin in their blood, turning a failed attempt into real results. So if you're using turmeric without black pepper, you're not getting the full benefit. It's not optional, it's essential. You don't need pills, you don't need expensive extracts, you just need to use it wisely. Rule 1, always pair it with black pepper, every time, in every dish. No pepper equals sign, no real benefit. Rule 2, add a healthy fat. Curcumin is fat-soluble. It dissolves in fat, not water, so pair it with olive oil, avocado, coconut milk, or ghee. This doubles absorption beyond what pepper alone does. Rule 3, use heat gently. Cooking helps release curcumin, but don't burn it. Sauté in oil for 1-2 minutes or add to soups and stews. Avoid high heat frying, it degrades the compound. Rule 4, dose matters, but consistency matters more. For real effect, 1/2 to 1 teaspoon of ground turmeric per day. That's about 500 to 1,000 milligrams of curcumin. You don't need a recipe, you don't need special ingredients. Here are 5 easy ways to add turmeric to your daily routine. 1. Golden milk. Warm milk, dairy or plant-based, plus 1/2 teaspoon turmeric, plus pinch of black pepper, plus 1 teaspoon coconut oil, plus dash of cinnamon 2. Turmeric eggs. Scramble eggs with turmeric and pepper. Add avocado 3. Roasted veggies. Toss carrots, sweet potatoes, or cauliflower with olive oil, turmeric, pepper, and roast 4. Soups and stews. Add 1/2 teaspoon to lentil soup, chili, or bone broth 5. Rice or grains. Stir into rice, quinoa, or mashed potatoes for color and benefit. It has a warm, earthy flavor. Not bitter, not strong. And over time, many people report less morning stiffness, easier movement, fewer pain spikes. Turmeric is safe for most people, but there are a few important notes. If you're on blood thinners like warfarin or aspirin, talk to your doctor. Curcumin can enhance blood flow and increase bleeding risk. If you have gallbladder disease, Avoid high doses. If you're scheduled for surgery, stop high-dose turmeric at least 2 weeks before. And if you have acid reflux or ulcers, large amounts may worsen symptoms. For cooking level use, generally safe. For supplements or high intake, always consult your provider. You'll find curcumin capsules everywhere, some with enhanced absorption claims, but many contain fillers, low-dose curcumin, or lack piperine. If you choose a supplement, look for curcumin with piperine on the label, or liposomal, phospholipid-bound, or micellar forms. Avoid anything with artificial additives or titanium dioxide, but for most people, whole food use is safer, cheaper, and just as effective. Because food doesn't just deliver curcumin, it delivers fiber, antioxidants, and synergy. This isn't a cure, it's not a replacement for medical care. If this helped you, like this video. It helps others find it.